Hello, my friends. Today I'm going to be covering the emergency kit. As we know, the topic of minimum emergency equipment in a dental practice is a very common question in all dental examinations. This is something you can come across in your ORE2, LDS examination, and also as an undergrad student. To better understand and memorize the equipment, I'm going to group them into four main categories. Number one will be the equipment required for oxygen delivery. Number two would be the equipment required while we're managing airway. Three, the equipment required when we're delivering emergency medication. And four, the equipment required for monitoring and diagnostic tools.
Okay. Oxygen delivery systems refers to the medical equipment and methods that we use to provide oxygen to a patient who needs help breathing or to maintain proper oxygen levels in their body. The reason we give oxygen in medical crisis includes some of the following reasons. One, to increase the oxygen levels in the body. Two, to help ease the patient's breathing. And three, to prevent complications that can arise from oxygen deficiency. Some of the essential pieces of equipment that allow us to deliver oxygen effectively during a medical emergency in a dental setting include a portable oxygen cylinder. Now, we know that the GDC states that all dentists or registrants must follow the guidance set by the Resuscitation Council UK. So, when it comes to this piece of equipment specifically, the requirements for this one is that it must be portable and immediately accessible in clinical areas. It should deliver 15 liters per minute of oxygen for sufficient duration. So you're looking around 20 to 30 minutes. So the ideal size for this would be a full D size cylinder. The second equipment is the non rebreathing or reservoir oxygen mask with tubing. This one is for patients in respiratory distress or patients who collapse. Remember that the key point here is that when we use this piece of equipment, the patient is still breathing. Okay? The purpose of this equipment is to deliver high concentration of oxygen for breathing patients. Then you've got the pocket mask with the oxygen port. This one, on the other hand, is used to ventilate non-breathing patients. The main point or the advantage of using this mask is that it allows rescue breaths to be delivered with or without oxygen. The oxygen port on that mask, as you can see, enables the supplementary oxygen. And this mask is usually safer for the operator or the healthcare provider in this instance. Now, I need you guys to remember that these three items are not optional, not in real life, and not in a dental exam question. Okay, they are actually the baseline requirement for a dental emergency kit. Now, in dental examinations, they do very frequently ask this question. So it's basically the minimum requirements for a dental emergency kit. These three make up part of that list. Okay? Okay, my friends, I have had to unfortunately cut the video short, so I will end it here because I am feeling unwell. Don't forget to like, subscribe, and turn on the notifications so you don't miss the part 2 video and other ORE, LDS, postgrad, and undergrad revision videos. Please also share with anyone that you know will find this important. This all helps to ensure that the service stays free. Thank you.